Hi there. I was just finishing my notes. He says, let's talk about anxiety. Uh, Anxiety is a feeling of fear or dread, um, or an uneasiness. It might cause you to sweat, feel restless and tense, have a rapid heartbeat. It can be a normal reaction to stress. For example, you might feel anxious when faced with a difficult problem at work, before taking a test, that's definite, or before making an important decision. Anxiety is a normal reaction to stress. It can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. Anxiety disorder differs from normal feelings of like nervousness or anxiousness, and involves excessive fear, excessive anxiety. Anxiety disorders are the most common of mental disorders and affect nearly 30% of adults at some point in their lives. But anxiety disorders are treatable, and a number of effective treatments are available. Treatment helps most people lead normal, productive lives. In any given year, the estimated percent of U.S. adults with various anxiety disorders are like specific phobias, or like a 12%, or social anxiety disorders is like 7%. Anxiety refers to anticipation of a future concern and is more associated with muscle tension and avoidance behavior. Fear is an emotional response to an immediate threat, and is more associated with a fight or flight reaction, either staying to fight or leaving to escape the danger. Anxiety disorders can cause people to try to avoid situations that trigger or worsen their symptoms. Job performance, schoolwork, and personal relationships can be affected. In general, for a person to be diagnosed with an anxiety disorder, the fear or anxiety must be out of proportion to the situation or age inappropriate. Hinders ability to function normally. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, specific phobias, or there's a agoraphobia I just learned about. It's a social anxiety disorder and separation anxiety disorder combined. So types of anxiety disorders is the first one is generalized. Involves persistent and excessive worry that interferes with daily activities. This ongoing worry and tension may be accompanied by physical symptoms such as like restlessness, feeling on edge or easily fatigued, difficulty concentrating, muscle tension, or problems sleeping. So often the worries focus on everyday things such as job responsibilities, family, health, or minor matters, such as chores, car repairs, or appointments. Panic disorders, the next one. It's the core symptom of reoccurrent panic attacks or overwhelming combination of physical and psychological distress. During an attack, several of these symptoms occur in combination. Palpitations, pounding heart or rapid heart rate, sweating, trembling or shaking, feeling of shortness of breath or smothering sensations, chest pain, feeling dizzy or lightheaded, even faint, feeling of choking, numbness or tingling, chills or hot flashes, nausea or abdominal pains, feeling detached, fear of losing control, fear of dying. Because the symptoms are so severe, though, many people who experience a panic attack may believe they are having a heart attack or other, life-threatening illness. So they may go to a hospital emergency room department. Panic attacks may be expected, such as a response to a feared object or unexpected, apparently occurring for no reason situations. The mean age for onset of panic disorder is the age of like 20 to 24. Panic attacks may occur with other mental disorders such as depression or PTSD. Phobias, a specific phobia is excessive, but they can't overcome it. These fears cause such distress that some people go to extreme lengths to avoid what they fear. Examples are public speaking, fear of flying. Examples of the other one was the agoraphobia. It's the fear of being in a situation where escape may be difficult or embarrassing, or help might not be available in the event of panic symptoms. The fear is out of proportion to the actual situation and lasts generally 6 months or more and causes problems in functioning. A person with agoraphobia experiences this fear in 2 or more of the following situations: using public transportation, being in open spaces, being in enclosed places, standing in line or being in a crowd, being outside the home alone. I'm going to add definitely taking a test even online. The individual actively avoids the situation, requires a companion, or endures with intense fear or anxiety. Untreated agoraphobia can become so serious that a person may be unable to leave the house. A person can only be diagnosed with agoraphobia if the fear is intensely upsetting or if it is significantly interfering with normal daily activities. So social anxiety disorder, it's also called like a social phobia. It's a person with social anxiety disorder that has significant anxiety and discomfort about being embarrassed, humiliated, rejected, or looked down on in social interactions. People with this disorder will try to avoid this situation or endure it with great anxiety. Common examples are like extreme fear of the public speaking, meeting new people, or eating, drinking in public. The fear or anxiety causes problems with daily functioning and lasts, even up to a year. So then there's a separation anxiety disorder, which is a person with separation anxiety disorder is excessively fearful or anxious about separation from those with whom he or she is attached. The feeling is beyond what is appropriate for the person's age, and it persists at least 4 weeks in children and 6 months in adults. And causes problems with functioning. A person with separation anxiety disorder may persistently worry about losing the person closest to him or her, may be reluctant or refuse to go out or sleep away from home or without that person, or may experience nightmares about separation. Physical symptoms of distress often develop in childhood, but symptoms can carry through adulthood. Risk factors. The cause of anxiety disorders are currently unknown, but likely involve a combination of factors, including genetic, environmental, psychological, and developmental even. So anxiety disorders can run in families, suggesting that a combination of genres and environmental stresses can produce the disorders. Diagnosis and treatment. The first step is to see your doctor to make sure there is no physical problem causing the symptoms. If an anxiety disorder is diagnosed, a mental health professional can work with you on finding the best treatment. Unfortunately, many people with anxiety disorders don't seek help. They don't realize that they have an illness for which there are effective treatments available. Although each anxiety disorder has unique characteristics, most respond well to two types of treatment, which is the talk therapy and or medications. These treatments can be given alone or even combination. Talk therapy will help you learn a different way of thinking, reacting, and behaving to help feel less anxious. Medication will not cure anxiety disorders, but can provide significant relief from symptoms. Self-help, coping, and managing even. Uh, there are a number of things people do to cope with symptoms of anxiety and make treatment more effective even. So stress management techniques and meditation can be helpful. Support people, either singular or in groups, can provide an opportunity to share your experiences and coping strategies. Learning more about the specifics of a disorder and helping family and friends to understand the condition better can also be helpful. Avoid caffeine, which can actually worsen your symptoms. And do a check-in with your doctor, okay? I hope this is helpful, and I hope you have a wonderful day. Thanks, guys. See you later. Bye.